Imelda. I'm a level 2 nursing student at McMaster University. Can I get your name?
Miss Mancini,
Okay, and your date of birth?
10/16/1964.
Okay, so Miss Mancini, today we're going to be inserting a catheter tube into your urethra and into your bladder, just so that we can drain the urine from your bladder and into a catheter bag. You may feel some slight discomfort, but if you're in any pain, let me know as soon as possible. And the catheter is just needed because a bladder scan revealed 630 milliliters of urine in the bladder, and you've reported the sensation to urinate, but have not been able to void in 8 hours. So I'm just going to perform some hand hygiene before we begin. Okay, so the positioning for this procedure is the dorsal recumbent position, with the patient lying on their back with their knees flexed and their thighs relaxed. The supplies that I'm using are a Foley catheter tray and a 12 FR Foley catheter. The reason why we're using a 12 FR Foley catheter is just because the patient doesn't have any debris or mucus or blood clots in the urine that may occlude the lumen of the catheter. And now we're going to open up the Foley catheter tray, making sure to maintain the 1-inch border around the sterile field, touching only the corners. Okay, so now I'm going to put on my sterile gloves. And now I'm going to grab the drape and place this underneath my patient with the shiny side facing down. Now I'm going to get my sterile solution and put them on these cotton pads in order to clean my patient. So now I'm going to move my tray onto my sterile drape. And I'm just going to remove the supplies. I'm going to take my lubricant gel and pour it into the tray. Okay. Now what I'm going to do is I'm going to take my catheter and get out of And what I'm going to do now is just lubricate the end about 1 to 2 inches around. So to cleanse the patient, I am now going to separate the labia with my non-dominant hand. I'm going to take my sterile solution with my sterile cotton balls and cleanse the far labial fold, making sure to swipe from the clitoris to the anus with one swipe. Using a different cotton pad, I am now going to cleanse the inner labial fold. And lastly, I'm going to cleanse over the urethral medius, being sure to only do one swipe for a cotton ball. Now I'm going to insert the catheter, picking it up 3 to 4 inches from the tip, and I'm just going to separate the labia. And slowly insert it. And I'm going to continue to insert it until I see urine appear in the catheter tray. This is how I know I'm in the right place. Once I see urine in the catheter tray, I'm just going to advance the catheter 1 to 2 inches. Now I'm going to inflate the catheter balloon using 5 milliliters of water. I'm just going to insert this slowly. just going to pull back until I feel resistance. So I feel resistance, and just advance the catheter, which means it's in the right spot. And the balloon is inflated. So now I'm going to attach the catheter to the catheter bag. So I'm attaching these two tubes. And then attaching the catheter bag at a lower height than the patient, just so that the urine can drain. Okay, so Mrs. Mancini, now I'm just going to discontinue the use of the catheter. So what I'm going to start with, I'm going to look at the catheter bag and see if it's empty. Right now it is empty, so I can remove it from the bedside. And now I'm just going to deflate the balloon inside. And I'm going to deflate it to see 5 milliliters of fluid. Okay. And now I'm just going to slowly pull out the catheter. Okay. What I'm going to do now is I'm going to dispose of the catheter in the biohazardous waste bin. And I'm going to perform hand hygiene. So I'm going to wash my hands as opposed to hand sanitize due to the potential risk of body fluid exposure. Some key points to document about this procedure would be the date of insertion, the removal, the time, the size of the catheter used, the volume of liquid in the balloon, where the catheter was secured to, and the characteristics of the urine, so such as color or volume, and lastly the patient's reaction to the procedure.